when someone comes in for an assessment at Sandstone Care, what we really want to do is just that, figure out where they are and what they need. We'll meet with the family as a collective whole, usually about 15 minutes or so, letting each member of the family talk about the circumstance from their perspective. And then we'll ask the family members to leave. We'll keep the individual who's coming into the program for the assessment in and do a one-on-one. We are doing a comprehensive assessment over their medical condition, their psychiatric, their social, their academic, their vocational, their family, their substance abuse history. We're going into every aspect of how they're showing up in the world. We gather that information. We do some screenings with them, screenings on drug use. We do it on alcohol use. Sometimes we do it on trauma. An adolescent assessment is really focused on how they're doing in school, what's their peer pressure look like, what's their academic look like. Ask questions that are age appropriate, and that's really what we're trying to capture is what should your life look like in general at this age range. And then the young adult assessment focuses on the same categories, but it's age appropriate for young adults. It's more on how long have you had a job? What's your longest full-time job? What do your social relationships look like?
So an assessment at Sandstone Care becomes a tool that the family and the young person themselves can use. It is an assessment that can be utilized to advocate for what the client's needs are, for what they're going to need to succeed, and it can give a direction of ways to go. We hope that they will stay with us, but it's also a working tool that they can walk out the door with, knowing that they have received a service. I would say to a teen or a young adult thinking about coming in for an assessment that there are not going to be any things decided at that point. It's going to be a back and forth process of them and the evaluator deciding what's best for that person. It's also going to include the family's input and their evaluation to consider what needs to happen for the whole family.